And it's a Five Live Breakfast team, two great experts coming up, because now we're going to try and answer as many of your questions as we can, as ever, every hour on the half hour. And until we're now going to focus on how you're coping. We're only into week 2 of what looks like a pretty long time of social distancing.
So with us now, the GP, Dr. Rosemary Leonard. Hi, Rosemary.
Morning.
And psychologist Sue Firth. Good morning to you, Sue.
Morning.
Right, 08085 909 693. Text us on 85058. Let's do this. Sean, good morning to you.
Good morning.
Thank you for getting in touch. We've got a question from you. I think it's a medical one. Fire away.
Yeah, it is a medical one. I suffer from severe obstructive sleep apnea. At the time of my diagnosis, I was recorded as having 62 episodes per hour, which equates to not breathing for 10 to 15 seconds every minute. What I would like to know is that if I contract coronavirus, what my risk profile would be.
That's interesting. Rosemary, a lot of people suffer from this. Rosemary.
Yes, I had a patient only yesterday asked me about this. I've seen no specific research on it. So to say exactly what your risk will be is difficult to say. But if you have no other underlying health conditions, then I wouldn't think you are significantly at increased risk of getting the pneumonia that can go with COVID. But if you are obese, which a lot of people are, and you haven't said, and I'm sorry if you're not, but if you are obese, that can add to your risk, and that often does go with sleep apnea. So losing weight can be very helpful and lower your risk.
Okay, that's great. I'm not obese, by the way.
Good, well done, well done. In which case, I
love that,
say,
doctors. Well done. That was good.
Yeah, but the sleep apnea, it shouldn't put you at significant increased risk.
That's great. I use a CPAP machine.
Yeah, keep going
every
with
night, and that seems to work very, very well.
Continuous positive airway pressure. And in fact, there's been quite a lot of information in the news about this type of machine actually being used for patients with COVID infection, helping. What they do is their positive airway pressure helping to put oxygen into the lungs.
Absolutely. Thanks to our friends at Formula One. Thank you very much. Take care, Sean.
Okay.
Sleep as well as you can. Cheers. 7:43.
Let's bring in Shivani now. Shivani, good morning.
Good morning.
Shivani, we want to talk about some of the issues around being on your own, living on your own during this current phase in our lives. How's it going for you?
So, just like everyone else, I was cycling through feeling super calm and productive to insanely anxious and overwhelmed. There was a lot of information out there for everyone to absorb. And I recognized that, I have to kind of perk myself up and maintain high spirits because we are in this for quite a long stretch.
So you are obviously working from home at the moment, living alone as well. How are you managing to occupy your time and keep a sense of feeling connected?
Yeah, so there is a lot of guidance out there suggesting, how having a routine helps with mental well-being. So I decided to try it out. And I can honestly say it's completely transformed the way I physically and mentally feel. Every day no longer feels like a Sunday. And, I finally have that weekend feeling back.
Yeah, that's important, isn't it? Just to keep the kind of rhythm of our lives in place. Sue, what advice would you have for someone like Shivani?
Yeah, I would say Shivani's doing absolutely the right thing. I discovered this for myself as well. I also batch jobs together so that certain types of things where I play to my strengths. So, for example, if I'm at my best in the morning, I will put all my creative stuff or my really good pictorial kind of stuff that I really enjoy working on into that part of the day. And then I will do the bits which are a bit less entertaining at certain other times of the day. I also structure a proper lunch break and I try and finish my day in a structured way, much like you would if you were at work. And then you feel a bit more tired as well, actually. You feel more exhausted, which is a kind of positive feeling because then your wind down time is spent doing what you would normally do in your home. And of course, this is our problem in a way. We're all at home, which is where we rest and relax instead of being able to altogether focus. So structure's a really great tip.
And it's all very well saying, Zoom your mates, Zoom your family or whoever it might be. But if you don't have that around you, if you don't have that wider network, for whatever reason, how can you access company and emotional support?
Well, I've always found it really works for me. If I have the radio on quite low level, actually, or the television on an entertaining program, and I'm not discounting the benefit of watching or listening to the news at the right time of day, because facts and figures can still help you to some degree, but not too much, because the overstimulation of hearing negativity around you is quite uncomfortable. But we've long since known that having companionship doesn't necessarily mean you have to have people connected next to you, physically with you. You can hear voices, you can hear family life, you can hear activities, and those are quite nurturing and soothing. So just having something on that's quite low level, or listening to audio music in some way, shape or form, same kind of thing. It just helps you feel a little less aware of being on your own.
Shivani, just a final thought from you. I know that you're trying to kind of keep yourself productive and doing new things. So advice to other people, what new ideas or new creative avenues can you explore?
Well, I mean, then it's nothing crazy. I mean, in the past week, I've learned how to make really nice coffee. I learned how to give myself a manicure and do my own nails. Yesterday, I even changed a light bulb for the first time.
Congratulations.
Yeah. So I feel like I'm going to come out of this as a strong, independent woman. It's going to be like a quarantine glow up. But it's, for me, it's all about perspective as well. Instead of saying I'm stuck at home, if you try saying I'm safe at home, you'll notice that change within yourself. And if I could give anybody a piece of advice, it would be like, it's totally okay to wear comfortable clothes, but just change out of those pajamas. We may be staying inside, but we still need to show up. We need to take care of ourselves so that we're strong enough to take care of others.
Thank you so much, Shivani. And my 4-year-old's been in his pajamas for the last 48 hours, so I'll try and impress that advice on him today. Thank you and good luck. And Nikki, people may scoff at the idea that, learning to change the light bulb is a significant moment, but for some people it is, and we should applaud Shivani.
Yeah, brilliant. I must try it. Your 4-year-old has been in pyjamas, as has your 44-year-old, I believe. There's a quick one here, actually, on new perspective. Just a text to read out on doing new things. As a retired returning nurse, I'm starting a new skill today, how to look after COVID-19 ventilators. On the other hand, I'm learning how to crochet, and we'll carry on doing that tonight. You have to try and keep a perspective. Exactly what Shivani was saying. Thank you very much for that. Let's go to Chrissy in Hampton. Good morning, Chrissy. Lovely to have you on the programme.
Oh, thank you, Nikki. My question is, I've been in self-isolation. I mean, complete self-isolation. Haven't been to a shop, done anything. I've been out on my bike, but kept to the roads, not gone through the parks. And I was working from home for those 2 weeks. The last day of being at work, I spent a day with a colleague who unfortunately then came down with the virus. So that's why I went into self-isolation. My daughter, who lives in Putney, thinks that she's had the virus. Last week she had the cough and the temperature. Is it safe for me to go and drive and pick her up and bring her home? Or is it safe for me to meet with family and friends who have been really strict about self-isolating? Are we safe to do that? Or, to have some kind of personal contact? Because I've just been furloughed as well, so I don't have my work to keep me occupied. What are the guidelines around that?
We'll sort that out. But what has it been like for you being alone?
I think whilst I was working, it was fine because, working sort of from 7 in the morning till 7 at night, constantly sort of being in contact with my colleagues, and I didn't really notice it too much. But now, not having that to occupy me, that sort of has knocked me somewhat, knocked my confidence somewhat.
Sure. Rosemary, so what about the situation there that we're hearing from Chrissy?
The guidelines are you only have social contact with your immediate household members. That's what we're all being told to do. So for instance, I live in one part of South London. My 30-year-old son lives in another part of South London. I have not seen him and will not see him because he is living in a different household. It's tough, but those are the rules now. So for instance, for you now, you've done your 2 weeks of self-isolation. You can go to the shops, but if you go and pick up a child, then that child has to stay within your household.
But her daughter has had the virus, she thinks.
Well, yeah, but we don't know that. And this is where our problem with with the lack of testing is coming in. So, if her daughter is coming over, then you have to stay within your household unit. That's what we're all being told to do. And I know Easter is coming, and I know it's going to be really tempting to say, oh, I'm just going to pop over. But the answer is no. And you saw what Stephen Kinnock, who went over to see Neil Kinnock and his mother, and he left stuff on the doorstep. And the general opinion was no, you don't do that. You stay within your household unit. And
it was
it's
a right
tough.
kiboshing he got, wasn't it? Thank you.
Yeah.
And Chrissy, thank you very much for getting in touch. Not great news, but I hope it was helpful.
Thank you very much indeed, Nikki. Take care. Bye-bye.
You too. 7:51.
This is Chinju in London. Hi, Chinju.
Hi, Rachel. How are you?
Yes, I'm not too bad. How are you doing?
I'm good. Thank you. I just wanted to start off by saying thank you, guys. I mean, I'm restricting my news diet to the 1 hour in the morning on 5 Live and then the evening press conferences so as to not go insane. But so thank you for keeping us abreast.
Thank you for being with us. And listen, if we've got you for an hour, that'll do us. What would you like to know, Chinju?
Yeah, I mean, probably not as serious as some of the earlier queries, but, yesterday I was on my, 1 hour walk with my dog just to get some fresh air. And one of the ladies who were walking another dog told me that, just be careful that your dog's paws might be kind of carrying the virus. So before you get home, please be sure to kind of disinfect his paws. So I was just wondering if there is any kind of medical evidence to that whether animals can carry the virus, whether I need to be careful about petting other dogs in the park, whether my dog's paw needs to be disinfected before he enters the house, etc. So is there any medical guidance on that?
This is actually something that's come up before, and you think it's the most innocent thing in the world, isn't it, to take your dog for a walk? And yet that seems to be fraught with risks as well. Dr. Rosemary Leonard, can you help us on that one?
So if you go and stroke a pet that's just been stroked by its owner, and its owner had the virus on their hands, and then they went and put it on that pet, and you immediately then stroked the pet, you could have picked it up on your hands. Mm-hmm. So, I mean, if the paws are going to be covered with goodness knows what from what they've walked on. So, and actually, the chance of the virus being on the ground, it can survive on hard surfaces, we know, for 2 to 3 days. So you would think, yes, you could theoretically pick it up from a dog's paws. So yeah, it would make sense to clean your dog after you and their paws. And as always, and then sanitize your own hands and don't touch your face.
That's what it always comes back to. Chinju, thank you very much. Enjoy your classical concert this evening.
And you got to still stroke your dog. If I can't tickle my dog's ears, what can I do? Let's go to... I tell you what, here's a text, Sue, which says, and it's good, it's kind of good tips and good structure, and I think you might be able to elaborate on this. I'm 67, says Jane in Loughborough. Morning, Jane. I live alone and I have a son who lives in Manchester. I'm normally very active. I've decided I must get up early every morning, do my hair, put on my makeup, go straight out for a brisk walk. This is extra time I wouldn't have. So I'm making the most of enjoying music, getting jobs done I wouldn't normally do, talking to friends on the phone regularly. It really helps. Stay safe, everyone. Thank you for those thoughts as well, Jane. So having that kind of a structure, Sue.
Yes, it's incredibly valuable, actually. And I'm very sorry that she's not able to go and connect with all of the lovely things that she's used to doing and the hobbies. All of us are feeling this. And I think that's the important thing, too, is to recognise you're not on your own in this. We are all in this together. We're all struggling up to a point with getting our heads around this. And there will be good days and bad days, or tougher days. But when you're getting a good day, try to capitalise on that. Where you can, despite perhaps maybe not feeling quite so tech savvy, if you're very used to looking on Google or something, do look for apps which are about yoga or maybe a bit of Pilates or meditation or breathing. These are a softer, soothing process as well in any one day, and they're valuable for all of us. But they give you that break time and that downtime, as well as being out and doing your fresh air, which I think is critical to everything we're doing. Look for the bright spots as well, because there is actually some good news out there. We're getting into spring. We're seeing nice stuff. Lots of people are being incredibly generous to each other. Remember, this is what humanity is about, and many of us are supporting each other that way too.
Thank you very much. It's a good time to go down a rabbit hole on YouTube as well. I got positively subterranean yesterday with a couple of those. Yes, sorry, please do, Rosemary.
Yeah, I was going to say also, it's very tempting to keep looking at the news and you can get COVID out. And I really would suggest, and I mean, I had a patient say to us yesterday, oh gosh, every time I look at the news, all I see is COVID, but I have to keep looking. And I would say, limit what you do twice a day, morning, evening. Don't keep looking at the news because it can be stressful.
Absolutely. But you can listen to it because then you hear Dr. Rosemary Leonard and Sue Firth as well.
Yeah, very important. I would say even actually be careful of the evening one, because the evening one is likely to give you quite a few dreams or quite a few scary or more anxious thoughts. You're prone to that, particularly because we're more tired. So perhaps limit it to the morning when you're a bit brighter, a bit more logical.
Absolutely.
Excellent
That's great advice. Really good. And because you can, at night, lastly, you can catastrophize, as I say, in the middle of the night.
This is where our own thinking gets tricky, because, we've been in those kind of habits long before COVID came along.
Well, ain't that the truth? 7:56.
This is Caroline in Watford. Morning, Caroline.
Good morning. Thank you for speaking with me. I've had a very mild cough for about 4 weeks, like a couple of coughs an hour, kind of internal cough, nothing to worry about. And at the time, we were very much thinking, cough and fever, etc., would be COVID. And so kind of thought, well, it's just a cough. I often get a cough and so on. So I didn't fully self-isolated, neither did the family. Nobody else has come down with anything, but I've still got this cough 4 weeks or so later. And from experience, no, I'm not going to get rid of this cough for ages. It happens regularly. What do I do now? I'm kind of worried, thinking, oh my God, well, should I now be self-isolating? Am I clear now? Did I have it? I'm not sure. I should also say I did go to Florence about 6 or 7 weeks ago. I did self-isolate from work for a couple of weeks after that, but the cough came after that.
So though we have COVID, we still have other things going on as well. And
that's what I've been thinking about, I suddenly thought, oh God, was I too blasé about that?
Yeah, so if you take COVID out of the equation, you've had cough going on for 6 to 7 weeks. You need to talk to your GP and find out, because there are other causes of a cough. The things that can cause a persistent cough, like acid reflux, heartburn, can cause a cough. Or it could be an allergy that's causing your cough. In older people, it can be a reaction to medication. So, we sometimes have to think, hang on, there are other things that are going on, and not everyone has COVID. And this doesn't sound like COVID. And what I would do is, with your GP now, you won't be able to get an appointment directly. You ring up and get a telephone triage appointment. And then your GP can help sort out what is causing that persistent cough, particularly if it's happened before. You need to try and get it sorted out.
Thank you very much. I hope that helps, Caroline. I know it gives you a bit more homework to do, but stay safe and look after yourself.
Yeah, thanks all so much, Rosemary. It's always such a delight to have you on, and you're so you just hearing your voice. Thank you, Dr. Rosemary Leonard, and Sue Firth. That was brilliant, Sue. Thanks for your advice this morning. We'll see you again.
Thank you.
This is a great thing that lots of people are doing. This is a text from Pippa. It's lovely to spend so much time with one's family, but last week I told them that they all have to go out at least one evening a week during this period. So my daughter went to a works drink on Zoom, and my husband FaceTimed his uni friends, and I had a virtual book group. So our social lives are picking up daily. That's from Pippa in St Albans. The wonders of Zoom, Rachel. Who's Zooming who? It's an amazing thing, isn't it?
It is. In fact, my diary is rapidly filling up with Zoom meetings at the moment, having been completely empty for a couple of weeks. So, and we did the Big Burden family quiz at the weekend as well, which was suitably chaotic.
Zoom meetings or Zoom social gatherings?
Oh God, no, social.
Social, right, okay. So Zoom meetings, okay. Yeah,
no, I'm not that important.
Yeah. Any other business?
No chance. Here's the news.
On digital, BBC Sounds, Smart